folks. Welcome to another program of Your Mind Matters. I'm Dr. Mike Ellison, joined by our producer, Mr. Mo Raza, and today we're talking about a really common issue, which is dental phobia. Many people, I have to say myself included, are persons who don't like to get dental care because it's been so scary in the past or painful. And so that's where we start today. Join us in just a moment for this conversation, a wide-ranging discussion of phobias. Thank you.
Describe your experience with dental phobia.
Well, I think a lot of people have dental phobia. Maybe from what I know, from maybe 1 out of 4 patients, because they've, like the last time she had to go to the dentist, she had this procedure and they gave her 25 injections into her gum, and it was just horrible for her. And she's never had dental phobia before, but now it's developed. So the reason that she called is she just got notified that she's having a procedure on Monday, and it just freaked her out. And so in my life, I had a lot of work done when I was younger, and so I found a dentist that was also a hypnotherapist. And for many years, he was the only person who could clean my teeth or do any kind of dental work inside, was because when you get in that fight or flight state, they can give you pain deadening medication all day long and it doesn't work, right? I mean, you've been in those situations where the adrenaline's flowing, and then after the adrenaline wears off, you go, "Oh man, I think I'm hurt," you know. And I've seen wounded people from gunshot wounds or from other kinds of injuries, that adrenaline starts to wear off and they start having pain for the first time. So that fight or flight response tells the brain, don't pay any attention to pain. Just ignore it. And because our survival is at hand, right? And so it's a natural thing that happens to the brain and the body. But then as soon as the danger is perceived to be gone, people will start to respond and feel the pain for the first time.
It's interesting because I'm thinking this is just made up. Like, this is somebody psyching themselves out. I mean,
yeah.
They give you good drugs,
right,
high concentrated drugs to keep you sedated or keep you at a calm level. Because I know if your heart rate's at a certain level or high blood pressure, they won't operate.
That's right.
Until you get a clearance from your doctor.
Yeah. And if you're like a lot of us that have what we call white coat hypertension, as soon as somebody comes by officially to take your blood pressure goes up because you're anxious and worried about it.
What could that be linked to?
Well, it's kind of like a junior version of PTSD, I think, because our brain associates being hurt in the past with this procedure. And so whenever that procedure starts again, just Pavlovian conditioning, when somebody shows up to take blood pressure, then we know something is going to happen to us. And just that simple association memory sets off that fight or flight. So our heart rate goes up, and they say, "Well, we can't do it today. Your blood pressure is too high."
So you're saying hypnotherapy?
Hypnotherapy might. In my case, hypnotherapy was very helpful for me as a client, and I've done a lot of hypnotherapy as a clinician with other people who have this, and so we teach them in the clinical setting how to use a form of self-hypnosis, which again, it uses those concepts of behavioral psychology that says if you link, let's say, a selected word, let's just pretend Superman is the word that I've selected. So if you're the hypnotherapist, you teach me how to relax my whole body, how to breathe slowly and deeply, how to enter into that peaceful, restful state that's sort of like meditation. But then when I get to that place, I say in my head, Superman, and then that introduces a whole lot of pre-programmed things to happen from your hypnotherapy with me. And when I say Superman to myself, I become really, really relaxed. I become unafraid. So that makes the client feel like they're in some way in charge of what's happening to them, which is a big deal because none of us likes to be
not in charge.
Not
like, what are you doing?
Yeah.
That's interesting because I'm thinking, well, when we talked about in earlier shows, the vagus nerve telling the heart to calm down. Mm-hmm. Now there's trigger words where you can say Superman, and your vagus nerve is telling the heart, hey, that's how you can manipulate the brain to calm yourself. That's
right.
Interesting.
And it's been around for tens of thousands of years. We know the religious writings of ancient Asia, the Bhagavad Gita, which tells people to look inside, which in that time was that introduction to meditation, I think. Look inside, calm the self, and that allows you to be calm in the storms of life, in whatever way that hits you. So that's really helpful to the client because they feel, okay, I am in control of myself. They may be doing surgery on me, but I can be calm. I can be calm. I can be at peace. I can not feel the pain, if that's what you've kind of been working on with your therapist. There was a famous physician who was a really good hypnotherapist. I've forgotten his name now, but I think I could find it pretty accurately if I needed to. But he was a surgeon, and he used hypnotherapy almost exclusively for deep surgery with his patients. And of course, he would talk to them during the surgery. And he would say, okay, you may feel some pressure when I do this, but the sensation of pain is absent. And he would he would say things like, all right, when you feel this pressure right here, that anesthetizes all of that skin right there and makes all the blood vessels clamp closed. And then he would open up the skin with a scalpel, it wouldn't bleed. People can do this. I've seen master martial arts people from Korea and Japan who can weave a iron rod through the two bones of their forearm. It doesn't bleed. Hook a pail of water on both sides and lift it up off the ground. So they're holding 15, 20 pounds of water with an iron rod through their arm. It's not a magic trick, it's the real thing. They're using mind over matter to control blood flow, sensation of pain. They put the little buckets of water down. They kind of slowly ease that out. They rub their forearm to restore sensitivity to their arm. They're not bleeding. You can see a little red mark where the wire or the rod went through their arm between the radius and the ulna bones of their forearm. It's incredible. It looks like a trick.
It
looks like a magic trick, but it's not. And I used some versions of that when I would do brick breaks to demonstrate, how to put your hand through 4 to 5 inches of concrete. You know, because I used to stack 1-inch concrete paving stones, 4 and 5 deep, and break them with my hands, and could do it all day long. It's not, you don't even feel the bricks. You don't even feel that they're there. It doesn't hurt.
Ligaments and
You don't feel it. I never felt it.
Wow.
Because what in my mind I'm focused on stopping my hand before I hit the concrete floor, because I know I can't, see, I've told myself I can't put my hand through the concrete floor, but I can put my hand, that's where I'm going to stop my force, but anything between there and the floor, it's not even perceived or felt.
Wow.
So you see these guys that'll stack up 10 or 12 ceramic building tiles and do some sort of like an elbow or a palm heel thrust into that stack of bricks, and they all break, and you think that's got to be a trick. They faked the bricks. If you go up there, they're real hard bricks. It's the real thing. They're not fake bricks made out of post toasties or something. They're the real thing. And so it's that mind over matter idea. So that's what hypnotherapy teaches the client. So the dental phobia can be really averted by having a skilled hypnotherapist say, okay, you're all calm, you're all inside, you know what's going to happen, you don't have to feel the sensation of pain. Patient doesn't feel the pain.
So, I see the benefits of it short term, because now, okay, say I go to the dentist, now I'm calm, or I'm going through surgery, I'm calm but how do I apply that behavior or that mindset when I go to just any dentist or surgeon?
Yeah, then you have to be really good at the self-hypnosis part.
Because you
can learn to do it yourself. And there are those hypnotherapists who say all hypnosis is self-hypnosis. We're just therapists teaching clients self-hypnotic procedures. Mm-hmm. And I think there's an element of truth in that.
I believe that too.
So counselors and hypnotherapists teach, here's what it feels like, here's how you can do it. Long ago, there used to be that skin anesthesia was a very simple way to teach the patient that they didn't have any pain, because you could introduce the idea, and then when it came time, you could take a little pinch of their skin right here, and the patient would themselves insert a sterilized needle through their own skin. It doesn't bleed. And then they would draw it back and kind of restore the sensitivity of that area. Still doesn't bleed. We can control so many things. People rarely understand that they have that capacity. And ironically, children are the very easiest to work with.
I can imagine.
Because they don't know that things are supposed to hurt, or they're afraid, but they like the idea that they can control that. And so this surgeon I was talking about worked with children and adults, did sometimes even very complex multi-hour surgeries under the influence of hypnosis. There's no adverse side effects to the anesthesia, right? So they wake up conscious. This is used quite a lot in Asia amongst the medical doctors. Chinese medical doctors are famous for using these kinds of procedures. But it turns out the surgeon himself had to have an appendectomy, and so he elected to do it on himself and rigged up his hospital operating room with mirrors so he could see into his own abdominal cavity, induced hypnosis in himself, opened up his abdomen, opened up that abdominal, like the abdominables. He opened his own abdomen, took out the end of his gut where the appendix is located, removed it, stitched it up, and then stitched up the wound that he created for himself, all through hypnotherapy.
So you become superhuman.
Yeah, kind of. To what most of us think is human. I think of it as a natural capacity of humans, but one that is rusty, little used, not talked about.
So how do we tap into that? I mean, this is good stuff that we need to be practicing and apply that, be a part of our lives.